our concern with paid sick leave legislation is not because we don't think that a humane workplace and employers offering sick leave is a good thing for the workplace, for the economy, for the city. So we certainly share that conviction, and according to our studies, we have found that, in fact, New York City is a place that has relatively very good employers who generally take their responsibilities to their employees, to public health, seriously. So we were happy to find that, and what we were able to determine through an Ernst & Young survey of employers in the city of all types and sizes is that about 88% of the city's 3.2 million private sector jobs, in fact, come with paid sick leave or paid leave that you can take at your discretion when you're ill. So the size of the problem is relatively limited. Our problem is the role of municipal government in getting engaged in employer-employee relationships. And that's really the question that we would raise for this group, not the relative merits of a workplace that offers paid sick leave. Without government providing any incentives, the burden of paid sick leave will fall on those who currently are not providing paid sick leave, who have other arrangements. That's not Wall Street, that's not corporate New York. That is certain industry sectors, we all know restaurants, neighborhood retail, construction, smaller companies. That's where the burden falls. And therefore, it's just very difficult to figure out how you kind of get around consequences that ultimately mean fewer entry-level jobs and fewer opportunities within the community.
You know, we were all in agreement that this is a morally imperative item we're talking about. People should never, ever, ever have to fear getting fired or getting punished for calling in sick. And we, as well as the rest of you, do not want to see any employee going to work when they're ill. It's just a question of how we get there. But I look at this and I compare it to other things that we have in society. I look at other morally imperative benefits that government has mandated to employers, such as disability insurance, unemployment insurance, Social Security insurance, all things that, again, morally imperative for the good of the people. But all of these have shared cost mechanisms. Disability in New York City is 60 cents to each employee. There's a contribution from the employer. There's a state insurance fund which helps with this. This would be the first type of mandated benefit for an employee which solely comes on the backs of business owners, small business owners. There are many parts of the bill that just don't make sense. If the number of days a person calls in sick is generally somewhere around 4.5, 2 days for themselves and 2 to 3 days for their family, if that's the number, then why are we having a two-tier system in a bill which has a built-in disincentive to help your business grow? The bill is designed to protect workers, the same way we have laws that protect child labor laws and workforce safety laws. But those child labor laws and those workforce safety laws, they come with punishments for business owners and employers who do the wrong thing. Now, I also believe that most business owners in New York City are good business owners and try to offer the best packages and incentives for their employees to make them happy and also to gather the best workforce. But I also believe that it's worthwhile to go after those employers who do the wrong thing, the same way we do for people who break child labor laws, wage and hour laws. So again, the way we're approaching this bill, I just don't think it's going to get to the end. If an employer is a bad employer, he'll ignore this law the same way he might ignore a minimum wage law or another law.
I just wanted to respond a little bit to the sense of the scale of the problem in New York City, because I think one of the things that we heard was, well, you know, 88% of the people have access to some kind of sick time. It's not really a big problem. But I think the point is that higher income workers and people in the corporate sector, like the members of the partnership, already provide paid sick days. That's true. But it's low-wage workers who don't have paid sick days, and it's the majority of low-wage workers who don't have paid sick days. And whether you look at our survey, the Unheard Third, which is done by Lake Research using a large sample, representative using random digit dialing, and that we've done over 10 years now, and consistently find that nearly 2/3, nearly 2 out of 3 low-wage workers living in families under 200% of the poverty level don't have access to a single paid sick day. Or you look at the BLS, the Bureau of Labor Statistics. We asked them to produce their unpublished data for just the New York metropolitan area, and they have said that for the bottom quartile of workers, it was either 63 or 64% don't have paid sick days. So whether you look at the BLS data or our consistent surveys over 10 years, the workers who don't have access to paid sick days are the low-wage workers, and it's well over 1 million workers in New York City. Our partnership study was based on a non-random sample online survey of 708 employers whose average size was 585 workers. Well, it's not surprising they didn't find there weren't too many workers without paid sick days. The majority of low-wage workers in New York City do not have a single paid sick day.
We represent about 375,000 healthcare workers that run the gamut of hospitals, professional, technical, and we have many entry-level, as well as 70,000 home care workers. About half of those home care workers do not have sick pay. Of course, these are workers who work with the elderly, they work with the indigent, obviously. They work with people who can't help themselves, whose families have to go to work and can't stay home with them. And these are workers who basically we have to fight for day in, day out to try to make sure that they can have some dignity in their work, that they can have the ability to take care of their families. And many of them don't. So this particular legislation that we're working for in the city that our union is very much supporting will help not only these workers but many other workers. As far as our home care workers, we're talking about adding approximately 3 cents to the per hour labor cost to allow these workers that I referred to 15 paid time off days in the course of a year. I just want to put that out there. 3 cents.
I think that employees do deserve sick leave, paid sick leave, okay? Because first of all, I have a little experience I went through recently. I am one of those who are scared sometimes and stayed home when I'm ill because it means having to deal with your employer fussing all the time. You know, nobody wishes to be sick, but we are all human beings. Our bodies are entitled to get sick at some time or the other. Why should you have to be penalized or suffer for it? You understand? As an employer, you get sick, you stay home, no worries. So why can't an employee afford 1 or 2 paid sick leave during the year? You know, I recently was forced in February. I was diagnosed with a little illness where I had to have surgery. I was out for 2 weeks. And mind you, I got nothing.
There was a study that the Economic Policy Institute conducted last year that shows that about 3.5 unpaid days of work, so a worker who has to take sick time, whether they're paid or not, that's equivalent to the family's grocery budget for the whole month. That means the families are not going into their bodegas or going into the grocery stores to buy those groceries, or they're sacrificing something else that they're not able to buy. So it's not just, you know, a worker here or there who's not able to afford groceries. It's actually, it's a lot of people, and it's not a very many number of days. There's also estimates that show that about 1/4 of workers have lost a job or been threatened with job loss for saying that they needed a sick day. And in this economy where it can take up to 9 months to find a new job for the median worker, that's just a lot of time that somebody doesn't have cash in their pocket to frequent local businesses. So I just wanted to make that point. And then one other, which is that even workers who do have sick days, about 40% of those say that they don't take them or that they've been retaliated against for taking sick time. And so if there's a culture of fear and a culture of not taking that sick time, it impacts the worker, it impacts the business, and it impacts the community.
I'm going to be talking about the effect of minimum wages. But a good question to ask is, what does research on minimum wages have in terms of bearing on the effect of paid sick leave? And there are a couple things to keep in mind that'll be useful before we go into discussion of the actual research. First of all, we can disagree about exactly how much a paid sick leave will cost businesses initially, but I think most reasonable estimates would find that that kind of cost increase is substantially lower than, for instance, the last federal minimum wage increase, which increased by over $2 an hour. In my discussions, I will draw upon my research with Michael Reich at Berkeley and Bill Lester at UNC Chapel Hill. This is a paper that we published in 2010 in the Review of Economics and Statistics, where we look at minimum wage changes over a fairly long period of time. What we do here is compare all the different counties that straddle a state boundary, which have a difference in minimum wage policies over 1990 to 2006. As you can see, there's just absolutely no evidence of any effect of the minimum wage on the average restaurant employment. And this is, again, pooling across a large set of counties in the United States with a variety of minimum wage differences over a 17-year period, and that's basically kind of the punchline, what we found in terms of the employment effect, where we're able to look at the effect on the turnover rate. And there we find a very clear reduction in job turnover that occurs within a quarter of the minimum wage increase, and it persists. A 2.7% reduction in turnover for a 10% increase in the minimum wage was a fairly sizable reduction, and that really provides some hint at some of the reasons we may not see overall job losses, that there are sort of other margins where people in the lowest wage jobs oftentimes are moving around, and this is costly for employers. And when you actually compress the wages by raising the bottom, that tends to allow workers at the lowest wages to stick around longer because these are somewhat better jobs.
We have increasing amounts of experience with paid sick days in San Francisco, Washington, D.C., Connecticut. We have a vast amount of knowledge and information about the minimum wage garnered over many, many years. So I think it provides a really good empirical backdrop for looking at the employment impacts of labor cost increases that are mandated on employers. And it's particularly relevant because it's concentrated in low-wage workers, which are disproportionately the workers that are going to be affected by paid sick days legislation. Imagine someone who was not uncovered took 7 of those 7 days. That would be an increase in costs of about 7 over 250, or about 2.8%. In the wage bill for that individual worker. Now, those workers are only a share of the overall employees in most firms, so the overall cost would be even smaller. But the other thing that we know from the evidence is that a much smaller share, very few people take all of their paid sick days. The averages that we use in our analysis is about 3.5 days. That knocks the total cost from 2.8% of the wage bill for affected workers to about 1.4%. Now, I'm leaving out a lot of potential small costs, and we analyze them in our report, and Kevin has discussed and mentioned some of those. The other thing that I'll emphasize, though, is we're leaving out any potential benefits from that. Reduced presenteeism, that is when workers show up sick, they're not very productive. Turnover, which Aaron alluded to, and Kevin as well. And then there's also the cost savings in terms of reductions in having other employees get sick. So I'm putting those to one side, and I'm just saying a 1.4% increase is something that's about reasonable. By comparison, what we're talking about, if we have a 1.4% increase, say in the cost for workers who are affected by a paid sick days mandate, it's somewhere between 1/6 and maybe 1/4 of the cost of the federal minimum wage increases on an annual basis. So we're talking about a fairly small number relative to something that we know quite well, which are the federal minimum wage increases.
Most economists think that an effect of an employer mandate on something like paid sick leave isn't just borne by employers, but rather in the future as potentially lower pay raises, and in fact a sizable portion of that cost may actually get transferred to employees, which will reduce the amount of employer burden.
How can this be? How can it be that you're increasing in cost for employers and there's not much impact on them? And I would say that there's a couple things to keep in mind. My view is that you have disproportionate bargaining power inequalities, and employers, even though they're in difficult straits on the margin sometimes, they have a lot more power relative to their employees who don't have a lot of job opportunities. And they can take advantage and they can set wages and benefits below what the market would otherwise suggest. But even within the mainstream economics literature, there's a lot of explanations. These costs can get spread out across a lot of different possibilities. There can be lower profit margins. There can be wage compression. You actually just pay people at the top a little bit less to compensate for it. You could have higher prices. You could have higher performance standards, a bit of a productivity shock. Employers realize, oh gosh, I need to restructure to absorb these extra costs. And the point that Aaron made, which is that there's lower turnover. And that doesn't even include the direct benefits of paid sick days, which can reduce presenteeism and reduce the spread of illness.
But I think also in terms of the experiences of small businesses and the stresses that small businesses are under, I think we've heard repeatedly over and over and over again about the impact that not having paid sick days has on working people and has on employees, and the struggles that they face with job security and economic security, especially in what's an incredibly difficult time. And I think what I've not heard really any examples of are businesses that have actually been put out of business, or workers that have lost their jobs because of a minimum wage increase or the institution of paid sick days. And when it comes to this, to this sort of issue of personal experience and experiences of individual business owners, it seems to me that the preponderance of the evidence is that the benefits of this policy for working people and working families far outweigh any real measurable or realistic impact on businesses. And I just wish that, if there's examples of businesses that have actually been put out of business by, labor standards being raised for low-wage workers, then I would like to see them.
Lack of basic days has a consequence not only for workers but also for business, particularly my community. Those workers are my customers. So we need to protect salaries. If we protect the salaries and if we give jobs stability, we are going to protect purchasing power of potential customers. If you try to give me tax cuts, I will tell you that I won't be able to generate any more jobs. And what really creates jobs in my community is customers. We need the capacity of power of our customers, but particularly the low-income Latinos are our customers in Jackson Heights, Elmhurst, Corona. So I just want to let you know that chambers of commerce can pay lobbyists. Small business owners cannot. So we have to talk by ourselves. The voice of real small business are going to start on these kind of tables. We will have presence more often, and we have to start to differentiate who is a small business owner and who represent big corporations.
So we do provide paid sick days, which in the logic of nowadays, when everybody's trying to cut corners, might be seen counterproductive. I am here to speak that such attitude, such move on our part has greater benefits beyond the statistics, I think. It humanizes the work environment. It does lend us the loyalty of our employees, and at a greater at the long run, it benefits not only us as a business persons, but also to the community that we are offering our services. We are dealing with food here, which is really intimate, an intimate relationship that we have not only with food, but with the customers. And this, so when we accept one of our employees to come to work sick, most likely will infect not only our coworkers, but our clients.
And I agree with Juan Carlos, and I agree with everyone who's concerned about the workers' dignity and actually all of dignity for all of us. You don't stay in business in New York City unless you provide quality for your workers. Customer service starts internally, not externally. It has to happen within your company before you can do anything outside your company. None of us will go into shops or deal with small businesses where we see people being treated improperly. So I think in the long run, the companies that survive are doing the right thing.
I have certainly talked to lots of business owners who oppose paid sick days until we have this conversation. So I'm from Milwaukee. We passed an ordinance, you may know, and by 70% of the vote, had it stolen. And there's a guy I buy hummus from every Saturday morning, very opposed. And I said, talk to me, because I know your staff, you know them. Are you really worried about them abusing it? He said, well, no, not them, but the summer help. I said, they're not covered. You have to be 90 days on the job before it kicks in. He had not been told that. Or a woman from a large bank I sit on a committee with. She said, oh, we're opposed because we were told it will cost us tens of thousands of dollars. I said, what are you talking about? You offer much more time than is required. She said, yeah, but it's PTO. I said, any pay time you offer can be used to comply as long as people can use it for the same reasons. There's a real disservice by this kind of disinformation.
I just wanted to make one other clarification.
Okay, and then we really do need to open it up for discussion. Go ahead.
Which is, just because I think Ellen didn't realize that the reassurances that she was able to give employers with regard to the Milwaukee law are not the same as the provisions of New York law. And for those though who don't know that, or proposed for New York law, I wanted you to know that.
I just wanted to clarify, because I did write the bill in Milwaukee and also the one in New York, so they're identical, at least on the issues that Ellen raised. The coverage of PTO is the same as any other, as paid sick days, and also the 90-day waiting period before workers can use it. And in fact, we made it even clearer that temporary and seasonal workers are not covered in New York. So it's the same bill.
I also am hearing some industry-specific issues, and I cannot comment on that because I'm not in that industry. But I would say to you that if you've got an industry-specific issue, then you need to sit down with the leaders in that industry and say, if you can't straighten this out, we're going to have to legislate it. And I can certainly support that on the highest level. So there just has to be some recognition that small business is not what you think it is. Small business includes people like me who have 40 employees and who do give benefits. It's not like I'm against benefits, but 9 sick days isn't necessary in my opinion. I think 5 would be adequate. I don't like the legislative approach, but I am recognizing that sometimes you have to do that.
In general, I think the validity of a public policy response in setting a floor, I think, has to do with a number of issues. In the case of sick leave, I think some people have talked about this. There's additional issues beyond simply a job security issue. There's a public health angle. There's an externality that's imposed potentially upon other people. But even quite apart from that, setting a floor allows also businesses that are doing the right thing in terms of providing public in terms of providing paid sick leave, not to be in competitive disadvantage. So it's basically setting a certain floor. And I think one of the things in my experience, especially studying minimum wages and talking to businesses before and after, and I'll give you some of this in the discussion about San Francisco after lunch, I think there's a lot of apprehension about what happens with these kind of policies because part of the adjustment that occurs isn't immediately obvious ahead of time, because small increases in prices of services and goods, for instance, can absorb a large portion of the cost increases. This is true in minimum wage increases, which allows for the fact that even if you have a 1% margin, profit margin, or a small profit margin, that's actually rarely affected. That's why we don't see a giant number of businesses going out of business when you have an increase in minimum wages. And we've had that happen for many decades, and as John said, to actually accumulate a pretty good set of evidence.
People say, well, leave it up to the employer for what they can do. But this is a larger problem than employers. It's a human problem. It's a societal problem. And for the life of me, I've never been able to understand why every other country almost in the world, but maybe 6, can take care of workers, allow them to take 6 weeks paid time off to relax, to take care of their families, whatever they need to do. But we have an issue with providing just the basic necessities for people who do our services, who help you run your businesses, and who take care of the larger majority of us in this country. We are passionate and determined to do our best, and we're glad to be sitting at this table. I think this is our first time at such a forum. I welcome these types of forums. I know that we don't have to agree on everything, but you have to start somewhere, and studies are what people look at. Figures are what people look at. When you talk about basic cost, if we're telling you basic cost and you're denying it, then, we should get in a room and hammer that out. That's what you do when you're negotiating.
We always hear this argument of the role of government, and government is impeding on private matters and business. But what's not talked about is when the mayor, for instance, we just banned smoking on the beaches. We don't hear that argument there. Now we're talking of banning smoking in residential buildings. We can't use this argument when it's conducive just for one person. We have to think of this thing holistically. This is a common sense bill, and we cannot afford to put a cost before individuals' lives. Small businesses will not be killed with this bill. To say that a small business is going to go out of business, we have to look at the owner of the business. Mr. Walmart, when he's out sick, the workers are still working and he's still receiving his full pay. When Mr. McDonald's is out, he's still receiving his full pay. So we have to look past the numbers and look at just being decent, being your brother's keeper, being your sister's keeper in a sense. This is not about money. This is about human dignity.
This time, all I'm going to do is tell you what about close to 800 businesses in San Francisco told us after they implemented this policy. This is just from the horse's mouth. These are businesses assessing for themselves, and generally, businesses were not particularly supportive of this policy prior to the policy having been passed, saying over 80% of employers reported that there was no effect at all on their bottom line, even for those firms that were offering for the first time a sick leave policy. Over 2/3 of them said that there was absolutely no effect on their profits. The vast majority of businesses in 2009, looking back after 2 years of experience with this policy, were supportive of the policy itself. Over 70%, and you can cut this by those who are offering a new policy, 71% of them said they supported this ordinance. Those who had a major change, 76% of them said they supported the policy. You can cut this by small, medium, and large employers, by the way, small being under 20 in this definition. And nearly 70% of those businesses said in 2009 that in the last 2 years of having to live with this policy, they actually support the ordinance. I think that's actually a remarkable thing, and actually not surprising in light of other modest changes in labor standards that actually, when they actually are implemented, businesses often find that, in fact, the world doesn't collapse as they know it. There are many ways of adjustments that may not be immediately apparent, but I think it really, I think in this case, the numbers do speak for themselves. I think any reasonable person actually just looking, either visiting San Francisco, finding hairs in their flour or whatnot, or simply looking at the Bureau of Labor Statistics unemployment rate, will at least know that the world as we know it didn't end.
Initially in San Francisco, employers were very alarmed about this law. Some of what we're hearing in New York sounds very familiar. Particularly, we heard from restaurant owners and temporary staffing agencies that, of their concerns. Those were sectors that tended to have no experience with paid sick leave. It was common that they would assume that the full amount of accrued time would be used. They were concerned about how to address abuse of paid sick leave. I really feel comfortable reporting that the implementation has been very smooth. Not all the days are taken. There's been no reports of rampant abuse. And our experience is consistent with the results of the surveys that you've heard about. I think the study showed that even though more than 5 or 9 days are available, that it's between 3 and 4 days that are taken, even in San Francisco with the paid sick leave ordinance, that low-wage workers and workers of color tend to be the workers most likely to benefit, and that most businesses have been able to implement the paid sick leave ordinance with minimal impact. In 5 years that the law has been in effect, our office has received 265 complaints. That's an average of 4.3 complaints a month. By way of comparison, the most recent quarterly census shows 557,000 workers in San Francisco. I know it's significantly less than New York, but we're a real city. And we have very similar sectors of types of businesses that New York has. The complaints are generally fairly easy to resolve. They don't involve a large amount of money. We were able to easily incorporate enforcement of paid sick leave into our enforcement of minimum wage, and we actually hired no additional staff to enforce the paid sick leave ordinance. We believe that paid sick leave is good public policy. It's good for workers, it's good for employers, and it's good for public health.
How have the chambers responded now that the law is implemented in general?
Both the Golden Gate Restaurant Association and the San Francisco Chamber of Commerce have been quoted, I believe, in various places as saying that this law is certainly less onerous than some of the others, and I think they've gone so far as to say that this law is good, they believe is good public policy that businesses can live with.
What I think I've been asked to do is to provide you with a little bit of context, kind of a way to think about this issue, both in terms of the morning's discussion and also in terms of San Francisco. So I'm going to make 4 or 5 points. The first point I want to make is to think about a way to tell you how I think about these issues. Both this issue, but in general issues around labor standards and how to improve working standards. What's our goal? Our goal is not, and I think it's very important to be clear about it, our goal is not to minimize costs to employers, right? If our goal was to minimize costs to employers, we'd have child labor. But we don't have child labor, and no employer in this room, and I'm sure no employer around, in New York supports child labor. But why don't we have child labor, right? We don't have it because we weigh the costs and benefits of any set of policies. Now,
providing employers with a cost structure that enables them to create jobs is a big benefit. We want to have employers create jobs, and we're grateful when they do that, but there are also costs. So, for example, just to take the case of child labor, the costs are both to the kids and to the society over long periods of time for kids who are either injured or sick from child labor or don't get an adequate education. So I think we have to weigh costs and benefits. And so I wouldn't want to get into a debate that said if there's some employer out there who can't hire an additional person or even who goes out of business because of some policy, that means that that policy should not be passed. We're weighing costs and benefits. Now, there are certain policies in which the costs are much higher than the benefits. And you can imagine, and I'll describe, for example, a range of regulatory policies that would be a bad idea. But in principle, that's what we're doing. The second thing I would say, in response in part to some of the discussion that we had this morning, is in thinking about a policy, you want to look at a range of evidence. So studies, academic studies, are certainly one piece of evidence. We also want to look at history, and history is important. We can look at accounting data. What's the cost structure of firms? But I think we also have learned recently that accounting data is not always what it appears to be. And we can use anecdotes. I know this company who has this experience. I know, let me bring in this worker, let me bring in that worker. So in the end of the day, we add up different kinds of evidence and arrive at a reasonable conclusion. And that's, I think, how we should be doing this, not by focusing on any one kind or any one piece of evidence. Now, what's the larger context in which this discussion is taking place? The larger context is inequality. There is a tremendous amount of inequality in this country along wage dimensions. You all know that. But what's important to understand is that the discussion in the last 6 months or so, partly due to Occupy, partly due to what President Obama is putting on the national agenda, partly due to the urgency of the issue itself, there's a great deal of interest in inequality and how to think about it and what to do about it. Right? Now, a lot of this discussion is about national policy. What should be the tax structure? How do we address those kinds of issues? But inequality also has to be addressed in terms of job quality, because one of the main sources of inequality is the nature of people's jobs. And inequality also has to be addressed in terms of mobility issues, people's capacity who are at the bottom of the labor market to climb a ladder and to move up. And I view paid sick leave as important in terms of job quality, which connects to the larger inequality discussion. But even more concretely, it relates to issues around people's mobility, right? Because the way you move up in this world, and Mr. Schwartz described it for his own history, right? He started off at the bottom of the ladder in his company, but he stayed in that company and moved up a ladder. If he had lost his job, if he'd been fired because he was sick, and had to move to another company, if he had an unstable work history because of that set of reasons, he would not have moved up. And that's a generalization, right? The generalization is that if you can't have stable employment, if you can't stay with an employer, if you cannot accumulate human capital, you're much less likely to be upwardly economically mobile, which is a bad thing. And you also are, therefore, we're not addressing the fundamental problem that we face now of inequality. So that's, I think, the larger context in which to think about this. So what's the evidence around this? Well, one evidence are the studies that Aaron described and other people have, and John has talked about. And my view, and I read this literature very deeply and very widely, is that what you've heard is right. That these studies of basically low impacts of the minimum wage are accurately capture what the evidence tells us about the minimum wage. And when you also heard that the kind of costs associated with this particular piece of legislation are quite low relative to recent minimum wage increases, I think it's very reasonable to conclude that the impact of this on employment will be quite low based on those studies. Now, I'd say two things about that. Again, in the context of the discussion this morning, a number of people said, yes, but firms face additional costs in the top of this legislation, that regulation. But all those studies were done in the context of firms that face those costs, right? So conditional on all firms already facing those costs, the impact has been quite low from a minimum wage increase. Now, it's also true that all these minimum wage increases are done in the context of studies are done in the context of relatively small changes in the minimum wage. I would never advocate, and I don't think anyone around the table would advocate, a minimum wage of $20 an hour. There's certainly an increase in the minimum wage which would be very destructive. And so the question is, we're weighing costs and benefits, we're weighing what's likely to happen here, and at the range we're talking about, the costs are minimal. Well, how about the evidence from history? Right from Triangle Shirtwaist Factory on up, we have raised the standards, we've raised the floor in the labor market. And listen, the American economy may be doing poorly now, but over the long run of history, the American economy has done extremely well, right? We all know that. High rates of productivity, high rates of job creation. And despite the fact that we've constantly pushed the floor up in the labor market through a wide range of policies. So I think history supports the proposition that reasonable increases in labor market standards are beneficial, not destructive. Against the firms, there's a substantial amount of evidence, both academic studies and anecdotal evidence, that in fact what's been said is true. The turnover goes down, that worker commitment goes up, the quality of service to employees goes up. Again, Mr. Schwartz, your employees treat your customers better because you treat them well. And in fact, the evidence does support that generalization. And so the benefits to the firms are there. And finally, this level playing field point, right? There are many, and I'm sure a majority of firms in the city that treat their employees well. But you don't want them to have to compete with firms that are cutting costs in the same product market segment by squeezing labor, because it's unfair competition. There's a general benefit to raising the floor, and the benefit accrues to firms, again, like Mr. Schwartz's firm, that treat their workers well, because he doesn't have to compete with another firm that isn't doing the same thing, and therefore has an artificially low cost structure. So when I weigh this all out, it seems to me that the case is pretty clear that this legislation, which is honestly quite mild legislation, the benefits really do outweigh the cost, and they do so by a substantial margin. And I do urge you to kind of think about this in the context of the larger debate we're having in this country about inequality and what to do about it.
Our goal today was to look at the evidence, to look at the research evidence, and I think our researchers were contributing the objective research evidence as well as the actual experience in San Francisco to understand what would be the likely impact of paid sick days here in New York City. I also saw today or heard some hope for agreement. In the opening remarks, I think people agreed in general that that paid sick days is a desirable thing if we can do it. And I think if we can agree on that, then we can certainly agree on how to craft a bill. On these points about exactly how many days or where we draw the line in terms of how small is a small business, should it be bigger, should it be smaller, these are things that we're flexible on, and I think can be worked out to craft a bill that will work for New York City. Now, those opposing paid sick days have said, while it's well intended, it would be a job killer. And as Ellen reminded us in her remarks, we have heard those fears before. The Associated Industries, after the Triangle factory horrific fire, said it would wipe out industry in this state. Well, we passed those laws then. Our workplaces are now safer. Children are in schools. Industry was not wiped out. And then we've heard the argument, well, we should do this, but we just can't do it right now. We can't pass paid sick days when we are struggling to recover from an economic downturn. We need to wait for the economy to improve. And that, too, sounds familiar. And here's another quote for you. Never in the history of the world has any measure been brought in here so insidiously designed so as to prevent business recovery, to enslave workers, and to prevent any possibility of the employers providing work for the people. That was another New Yorker, Representative John Tabor, Republican of New York, and what was he talking about? He was sounding the alarm against Social Security in 1934. But we know that it is exactly in hard times when we most need to pass measures to keep workers from losing their jobs and from losing their paychecks. And more recently, we've heard, well, the minimum wage has caused more misery and unemployment than anything since the Great Depression. Who was that? You guys probably know because you're all so smart. That was Ronald Reagan on the campaign trail in 1980. He hadn't read Aaron's paper. These dire predictions were not borne out then, and they will not be borne out now. We have heard the compelling research findings. We've heard what actually happened in San Francisco. It is time to put those arguments to rest. It is time to bring the job killer to justice. It's time to pass paid sick days in New York City. It's time that not only should the high-paid person sitting in the corner office have paid sick days, but so should the immigrant worker cleaning that office at night. And it's time that not only should the corporate executive eating the $50 steak and the $10 side order of string beans, and I know Ginny knows we checked the menu yesterday at Capitol Grill, not only should they have paid sick days, but so should the server have paid sick days. We can afford to do that in New York City, and the workers, the businesses in the city will be better as a result. We look forward to continuing this discussion that we started today and moving forward, and I thank you all so much for your participation.
Thank you.